Hello and welcome to your injection training. By the end of this video, you'll learn how to safely inject yourself with semaglutide. In your injection kit, you'll find a vial that looks something like this. You may unwrap the top of the vial in order to prepare for use. Next, take the provided alcohol prep pad and wipe the top of the vial in preparation for use. Now it's time to prepare the syringe. In order to avoid air bubbles, pull 10 milliliters of air into the vial and inject the vial with the 10 milliliters of air. While pulling the medication, you may flip the vial upside down or keep it flat on the table. For 0.25 milligrams of semaglutide, you'll pull 10 units. For 0.5 milligrams of semaglutide, you'll pull 20 units. For 1 milligram of semaglutide, you'll pull 40 units. For 1.7 milligrams of semaglutide, you'll pull 68 units. For the highest dose of semaglutide, you'll pull 2.4 milligrams, which is 96 units. Once you've pulled your medication, it's important to check for air bubbles. If you spot an air bubble, gently flick the syringe until the bubble dissipates. Now it's time to inject. Sanitize the injection site with an alcohol swab. Gently pinch the fat that you're injecting into, and without using too much force, glide the needle into the injection site. Push the plunger down to dispense the medication. Once the medication is administered, gently pull the needle away. Gently massage the injection site.